Several treatment options are available for managing pain and overall well-being. One intervention that's been gaining popularity in recent years is dry needling. Just like any kind of emerging, medical practice or intervention, there are some questions surrounding that intervention. This video aims to debunk some of the common myths and just overall misconceptions you might hear about dry needling. Hi, my name is James Ingram, and I'm a licensed physical therapist and dry needling specialist here in Birmingham, Alabama. Today I want to talk about 4 common misconceptions surrounding dry needling. The first is that dry needling is the same as acupuncture. Second is that dry needling is extremely painful. The third is that dry needling is exclusively for athletes. And finally, that dry needling is a standalone treatment. So the first misconception I want to talk about is that dry needling is the same as acupuncture. While they are very similar, they're not exactly the same thing. There are minor differences in the philosophies surrounding the two that make them very different. First off, acupuncture follows things that are known as meridian lines. And the whole idea of acupuncture is to restore qi, or the flow of energy throughout the body. So what these meridian lines are, they are predetermined points throughout the body. For example, say if you have low back pain, an acupuncturist may put needles all over your entire body. Where that differs between acupuncture and dry needling is targeted to certain muscle tissues normally. And so what will happen is we'll target a dysfunctional muscle or area of the body, and we will stay specifically in that area. So misconception number 2, dry needling is extremely painful. People normally associate needles with pain. We've all been to the doctor and you have to have blood drawn or you have to have an injection. It doesn't feel that great. That's not what dry needling is. Those needles that you're accustomed to are actually much thicker and actually hollow so that they can either, draw a substance out or put a substance into the body. Dry needling, these are full needles all the way through, but they're very, very thin. When people ask, is this gonna be painful? I normally say there's no more pain than what you're already going through. If we do get a big twitch response, sometimes the muscle will jump. Say, the upper trap is a very common area to get a muscle twitch response. You'll feel a little bit of discomfort, like some cramping for a second, and then everything lets go and relaxes. So when people ask what that twitch response is, I describe a power surge. So when a power surge hits a building, all the lights will get real bright for a second, but then there's a surge protector in the building and the lights will shut off. I kind of use that same analogy for dry needling. There's too much neural tension going into the muscle. So when the needle goes in, everything will get a little intense for a second, but then it lets go, turns off and relaxes. So misconception number 3, dry needling is specifically for athletes. This could not be further from the truth. While yes, it is true that a lot of athletes use dry needling for mobility work, recovery, it is not just for the athlete. Most people that I perform dry needling on are non-athletes. One of the populations that I consistently do a lot of dry needling on are people that sit a lot for a living and have what I call desk posture. When you get desk posture, there are areas that are going to be tighter and areas that are going to be weaker. What we're trying to do with dry needling is relax those tight areas so you can go throughout your day. And finally, misconception number 4, dry needling is a standalone treatment. This could not be further from the case. Dry needling should not be used as a standalone treatment. It should be used in conjunction with other exercises, other manual techniques, other neuromuscular re-education type interventions. Research data often looks at just dry needling and compares it to normal physical therapy intervention. When you compare the two sets of data that way, you don't see very convincing evidence. But that's because dry needling is not designed to be a standalone treatment. Dry needling is designed to be used as a part of a comprehensive plan to get you moving better and feeling better. Dry needling is a valuable treatment option for those seeking relief from musculoskeletal pain and dysfunction. If you would like to learn more about dry needling, click the link in our description below to watch our video, What is Dry Needling? This video goes into detail about how dry needling works and how it can benefit someone.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.